Good afternoon, everyone. This is the final installment of class on YouTube. And if you'll recall from the syllabus, there's no final exam in this class. Instead, there's a project that you need to complete. I have posted the project instructions to Blackboard, and what I'm going to do today is I'm just going to walk you through those instructions. Your final project is to design a new national health system. And to give you some context, imagine the following. Explorers discover a new tiny island off the coast of Alaska. This island becomes a new sovereign nation, and the president appoints you as the first secretary of the Department of Health. It is up to you to design the healthcare system for this new country. To design the new national healthcare system, you'll have to answer 3 questions. 1, how should health insurance markets work? 2, how should moral hazard be controlled in public insurance? 3, how should healthcare provider markets be regulated? Your project is to submit your plans for the new national health system. For each question, select the option or options you prefer amongst the options presented in Chapter 15, or propose a new innovative option that you come up with. Then, for each question, thoroughly explain the details of the option you choose, as well as list the upsides and downsides of this particular selection. Also indicate which healthcare models around the world, if any, use the option you select. There are 4 extra things I want to just mention in terms of instructions on the first page to help you along as you're working on this. One thing is that question 2 asks you about how you're going to control moral hazard in public insurance specifically. And the reason for the emphasis on public insurance is because if you are a policymaker and you have built into your healthcare system public insurance, that means that your employer, the government, is going to be issuing government-issued insurance cards. And those insurance cards inevitably will generate moral hazard and social loss. So you can mitigate that social loss generated by your own insurance policy to the extent that you build into the public insurance different factors or different ways of controlling the moral hazard. Another thing is that question 3 asks you about healthcare provider markets. Healthcare providers are the people and places that deliver the clinical care. So for question 3, you should be thinking about regulations as they pertain to doctors and nurses and clinics and hospitals and the actual providers of healthcare. This does not so much have to do with the financing of the clinical care, but the people and the places who are delivering it. Another thing I want to note is that each of these questions are exactly the 3 questions that are presented in Chapter 15, and Chapter 15 also gives you a list of options for how to answer each of these 3 questions. You can choose or you can mix and match some of the options within a question, but make sure that if you're going to mix and match the options, that what you choose actually fits together, and so that you can have kind of a cohesive plan that would actually work. And then the final thing I want to note on this first page of instructions is the last paragraph here asks you to list the upsides and the downsides of your selections. It's important to note that any healthcare system you might design is going to have some drawbacks. It's not going to be perfect. And so I want you to think through what the downsides are going to be of your design and be very transparent about that. They're going to be downsides. So make sure that you list exactly what those are going to be. Okay, so what do you actually need to turn in? For your final deliverable, present your plans for the new national healthcare system in a PowerPoint presentation, such as would be presented at a media briefing. Your PowerPoint presentation should have 4 slides. The first slide should be a title slide with your name and the title of your health system design. The second slide should address question 1. The third slide should address question 2, and the fourth slide should address question 3. Make sure that the content you include on each slide is thorough. That is that you have fully fleshed out the details of the option you choose, the upsides, the downsides, and have listed the other countries or models that use a similar approach. Real quickly, let me make 2 notes on the first paragraph of this page. On slide number 1, when you have to create a title for your health system design, the idea is that when the Affordable Care Act was passed, it informally got called Obamacare. And so I want you to come up with a similar title or name for your health system design. The second note is that when I refer to the questions in this paragraph, reference the page before this in the instructions. So these are the 3 questions that were presented in Chapter 15. Moving down to underneath the picture, after you have made your PowerPoint slides, save them as a PDF. Submit your PDF as your final deliverable by email, and I've included my email address, by no later than 4:00 p.m. Saturday, August 2nd. This is a hard deadline, so if you do not submit by this deadline, you will not receive credit. You'll be graded on accuracy, neatness, comprehensiveness of thought, design, and completeness. And of course, if you have any questions, feel free to email me and I'll try to get those ironed out as soon as possible. I want to give you a reminder how next week is going to play out. There will be no meeting, no YouTube next Monday and Tuesday. Instead, you are going to be given free time to work on your project those days. And again, the final project is due on a Saturday, no later than 4:00 p.m. All right, I am also going to give you an option or an opportunity to opt out of the final project with a particular caveat. And the caveat is as follows. If you would like to replace your final project score with your lowest exam score, I'm going to allow you to do that, and then you will not need to complete the final project. So let me say that one more time. If you would like to opt out, you can take your lowest exam score, receive that grade for your final project, and then not have to complete the final project. And to help you do the calculation, I have included the formula on the screen of what your class score would be if you chose the final, if you chose the opt-out option. So if you would like to figure out what your score would be if you chose to opt out of the project, what you need to do is you need to take your participation score, calculate the percentage that you'll receive. Note 2 things. Thing number 1 is that there's going to be an exercise today, so build in 1 extra point to your overall participation score. The second thing is that you get 3 freebies in terms of exercises. So include today in the calculation, give yourself 3 freebies, and then figure out your percentage on participation and multiply that by 0.2. Each exam also counts as 20% of your overall grade, so take your percentage on exam 1 and multiply it by 0.2. Take your percentage on exam 2, multiply it by 0.2. Take your percentage on exam 3 and multiply it by 0.2. And then pick the lowest of your exam scores, so the lowest exam percentage, multiply that by 0.2, add up all of that, and that will give you your class score if you choose to opt out of the final project. Okay, if you would like to opt out of the final project, you need to indicate this to me by email. So the due date for letting me know whether you would like to opt out of the final project is next Monday, July 28th at 4:40 in the afternoon. So I need an email in my inbox by that time if you would like to opt out of the project. If you do not indicate to me that you're going to opt out of the project and then you just do not turn in the final project, you're going to get a 0. So it's very important that you actually let me know. If you choose the opt-out option, this is going to be the last time you're going to hear from me probably, other than responding by email. So if you choose the opt-out option, you are effectively done for the class. Again, there's no meeting time next Monday or Tuesday for anyone. And then if you're opting out, you will not need to turn in the final project on the following Saturday. So you're done for the class. If you choose to complete the final project, again, no meeting time next Monday or Tuesday. Work on the final project next week. And then make sure there is a PDF of your PowerPoint that's emailed to me by the due date. And we have one final last exercise for the class. So your exercise for today is I want you to do the calculation for what your class score would be if you opted out of the project, and then submit that score on Blackboard. So I want to just make sure you're doing the math on your own so you can make an informed decision. So once you turn in your class score, if you opt out, you'll get your point for the day, and that will be it. If you have questions, again, feel free to email me. If you're choosing the opt-out option, definitely email me. And it was good having you in class this summer. I hope you enjoy the rest of your break, and take care.